Hi, this is a nursing professor here. I want to talk to you today about cultural competence and cultural awareness. As budding healthcare professionals, this is something you really need to pay attention to. It's all the talk in healthcare as we listen to news shows and things like that that talk about the importance of having diversity. And if you're going to talk about diversity, you have to have inclusion. So there's no way to talk about diversity if the field is not diverse enough. And so as I talk to people who look like me, the truth of it is this, is that there's only 8% of registered nurses are African American. And so when you think about that, it's very challenging to think about inclusion because the field of being a registered nurse is not really diverse. So I'm going to do a lecture on that, but I want to come to you today because I was just kind of scrolling through social media and I saw this doctor who apparently earlier in the week or maybe the end of last week who said he couldn't understand why his African American patients always remained on the phone during a hospital visit or during an office visit. And the truth of it is that he was saying it as though it was a negative thing. But the real deal was this, is that African Americans and probably many other cultural diverse groups feel the same way. They don't feel safe. And so if you have someone on the phone, that person is your advocate. So that person can actually see what's going on or hear what's going on. If you have, if you have them on the phone or if you're FaceTiming, they can actually see what's actually going on in the room. And so that brings a sense of security to the patient. And so you're kind of, deaf to whatever's going on if you are a provider of care and you don't ask something that you notice to be a repeated action. And so anyway, he got on social media, he talked about that. And anyway, people responded that no, that is how many times African Americans feel like they have a patient advocate in the room with them. And so the reason I bring this up is this, is that historically African Americans have been not treated well. We have so many examples of it. We have the Tuskegee study. We have the Henrietta Lacks study that happened over at Hopkins, where these people literally were not treated because they were put into a scientific study in order to find out information. However, they didn't give their permission. And so that's inhumane. And now today we look at the high rate of maternal deaths that are happening. And these maternal deaths are happening regardless of socioeconomic factors. Just because you look like me puts you at a higher risk of having a death during maternal childbirth. Something's wrong with that. And so again, trying not to get on a tangent because this is so personal to me, but I want you to feel and understand the importance of cultural competency and cultural awareness, because the truth is that I emphasize what happens to African Americans. However, this can happen to many other social groups. Okay, so I want you to think about the injustices that occur as a result of people just being African American. And so we have to minimize that. So what are some of the things that we can do? Is that we need more culturally competent nurses. And that's regardless of what color of your skin. We just need to make certain that you have been educated and that you practice in a manner that is respectful and consider what another group might be going through. And that is a matter of cultural competence. We know that disproportionately African Americans are victims of healthcare inequality and biases. And so we have to put a stop to that. And so when we talk about cultural competence, it's the ability for a provider to deliver care effectively without considering a person's race. And so I challenge you as you go through school and as you become new providers to always think about that. Because the truth is this, is that representation matters. For all of you African American nurses out there or nursing students out there, representation matters. And so as you get your degree and you move on, then you're being represented in the numbers that make that number greater than 8%. In effect, that's going to already skew or level up the playing field, where some of that inequity should go away. And so I want you to also think about ageism. You know, people who are older, many times they're thought to have dementia or that they don't know what's going on. So people tend to talk over them. Or people who are gay, you know, people come in with this assumption that because you identify a certain way that you're going to act a certain way, and that's not true. I was looking at a chart maybe like 2 evenings ago, and that a person was 86 years old. And so this person was at the end stages of life, and the providers were really confused about who was making decision for this person. And the truth of it is that that person's partner was making decisions for her. And so the person was 86 and the partner was 84. So, you know, somewhere in society we have this misconception that a person who identifies as being gay, that they're young, that it's all about their sexual experience, and it just really isn't. And so I just bring up a couple of groups that are frequently discriminated against in healthcare, and I want you to think about what you can do in order to become providers of care that can level the playing field and to provide care regardless of a person's race, belief, educational level. All of that needs to be considered when we're talking about cultural awareness, cultural competence. My last thing I'll say to you is this, is that class is in session starting Monday the 22nd. I know we spent the last 3-4 weeks talking about things to get you ready for this semester. And so my intent is to continue on social media with the YouTubes and Instagrams and all of those things, but I would like to do lectures with either slides or PowerPoints or some sort of visual aid to break down some of the concepts that you're actually learning in class. And so what I need from you is for you to give me some topics such that I won't come up with a topic myself, but create those lessons based upon what your learning needs are. I can say for one, the first lesson will be about infection control, because that is important regardless of what level of the nursing program that you're in. So I hope you really think about this, because we've got to change, y'all. We've got to change. This is 2024 and we're still talking about the same healthcare issues that happened 60, 70 years ago. And that doesn't make any sense. So thanks for listening. Bye for now. I will see you on Monday, and give me those topics. Give me those topics so that we can get you on the right foot and start to break down some of that information that you're actually receiving from your teacher in your school. All right. Have a great evening.